How are you? My class 10 English version students. Our subject name is biology and our topics is chapter 6. Today I also give you our last topics and our last topics is lesson 6.4.3 to 6.4.6. Here our topic's name is first. Please everyone see the board. Our first topic is blood vessels. Here I draw the first is artery, second is vein, third is capillaries. Now please everyone open the book and page number 145. Here what is the blood vessels? The channels through which mass flow of the blood occurs are called blood vessels. Through these vessels, blood is carried away from the heart to different parts of the body and back again. According to the size, shape and function, blood vessels are of three types. I also explained that. One is artery, vein and capillary. First, what is artery? The blood vessels which carry oxygenated blood. Please everyone marks this. Oxygenated blood away from the heart to different organs of the body are called arteries. The pulmonary artery is the exception. This exceptional artery carries deoxygenated blood from heart to the lungs. Each artery is made of three layers. See the board. Here I draw the first is tunica externa, which is made of connective tissues. Second is tunica media, the middle layer made of round involuntary muscles. Third is tunica interna, the innermost layer made of simple endothelial tissue. The walls of the arteries are elastic and thick. The arteries do not have any valves and have a narrow passage or lumen. Here I draw the first is, this word is lumen. When the heart contracts, the blood transports through the arteries and arteriole. Arteriole means same arteries like a wave. The expansion and contraction of the artery is known as the pulse. Again, please everyone marks this. What is pulse? Pulse means the expansion and contraction of the artery is known as the pulse. The flow of blood within the artery and elasticity and contraction and relaxation of the artery walls are the main causes of pulse. You can feel the pulse by pressing the fingertips of one hand on the wrist of the other. Second is vein. What is vein? When I explain the artery, it also flow oxygenated blood. Again, vein is flow the deoxygenated bloods or carbon dioxide types bloods. Again, vein, the vessels which carry blood from the various organs of the body towards the heart are called veins. They are spread all over the body, just like arteries. Veins originated from the capillaries. Here I also a middle. This is also capillaries. Numerous capillaries together form small venule. Veins and the vena cava open directly into the heart. Veins are also made of three layers, same as artery. Are thin-walled, less elastic and have less muscles. The veins have valves and wider passage or lumen. Veins carry deoxygenated or carbon dioxide enriched blood. Pulmonary vein is its exception. Again, pulmonary artery also the exception. Next, pulmonary vein is its exception. This vein transports oxygenated blood from lungs to heart. Here I also explain the vein. Next is capillaries. What is capillaries? The hair-like small delicate blood vessels visible in the muscle fiber are called blood capillaries. These connect with the smallest artery in one side and the vein on the other side. All arteries are divided into secondary and lateral branches and form a fine network of capillaries. Each cell is surrounded by blood capillaries. The walls of the capillaries are thin. Through this thin layer, substances dissolved into blood diffuse into the cells. So, our first lesson is blood vessels. Here I also explain artery, vein and capillaries. This topic is also most important topics for your next board exam. Our second topics. What is our second topics? Also the blood related topics. Our second topic is blood pressure. Blood pressure. What is blood pressure? Blood pressure is the pressure of the blood against the wall of the arteries. The contraction of the heart is called systole. The pressure in the artery during systolic condition is called the systolic blood pressure. The pressure in the artery during systolic condition is the highest. Relaxation of the heart is called diastole. So that we know what is the systole and the diastole. The pressure during the diastole condition is called the diastolic pressure. The pressure during the expansion of heart or ventricle, i.e., in the diastole condition is the least. Ideal blood pressure. A normal adult's blood pressure. Normal adults means the age of 18. Okay? A normal adult's blood pressure is generally near about 120 per 80 ml. Blood pressure is expressed in two numbers. First one is for higher, whereas the second one for the lower. The blood pressure in the arteries is the highest during systolic blood pressure, and the ideal range should be 120 or slightly lower. It's also another is the systolic pressure. Another is diastolic pressure. What is the diastolic pressure? The blood pressure in the arteries decreases during diastole. This is diastolic blood pressure, and the ideal diastolic pressure should be less than 80. In between the time of two heartbeats, this pressure is created. The differences between the two pressures in the arteries is called pulse pressure. Again, please everyone marks this. What is the pulse pressure? The difference between the two pressures, that means systolic and diastolic, in the arteries is called pulse pressure. The normal rate of the pulse, another name is the heartbeat rate, is about 60 to 100 per minute in an adult at rest. Normally, pulse rate is measured in the radial artery at the wrist. It can also be measured by the blood pressure machine, and the another name is sphygmomanometer. Again, I also repeat, this pressure machine's name is sphygmomanometer. By observing the systolic and diastolic pressure with the help of this machine, blood pressure is determined. Now, blood pressure related another things, high blood pressure or hypertension. High blood pressure is considered to be a silent killer. According to World Health Organization report, by 2020, stroke and coronary artery diseases will be the number one life-threatening diseases. In the South Asian countries, it will break out as an epidemic disease. But 20 to 20, we know that the epidemic disease is coronavirus. Yes. One of the main causes of heart disease and stroke is high blood pressure. So our next topic is cholesterol. Our first topic is blood vessels, another is blood pressure, and the third is the cholesterol. I also explain the cholesterol. What is cholesterol? Here, please everyone open the page 150. What is cholesterol? Cholesterol is a compound produced from the hydrocarbon cholesterol. It is an important component in animal cells. Cholesterol circulates in the blood as lipoprotein. There are three types of lipoprotein. Please everyone see the board. Here I also draw types of lipoprotein or types of cholesterol. Here also LDL, HDL and triglyceride. First, LDL. What is LDL? LDL means low density lipoprotein. This is called bad cholesterol because it increases the risk of heart disease. Generally, our blood contains 70% LDL. This varies from person to person. Second is HDL or high density lipoprotein. This is generally called good cholesterol because it decreases the risk of heart disease. Triglyceride. This cholesterol is in the plasma. Do you know what is the plasma? Another blood components. Here the blood components. One is the plasma and another is the plasma structure. This cholesterol is the plasma as fat triglyceride and is secreted from animal fat and carbohydrate. The ideal range of cholesterol in blood is shown in the table below. LDL or low density lipoprotein is greater than 1.8 millimole per liter. HDL less than 1.5 millimole per liter. Triglyceride greater than 1.7 millimole per liter. Foods such as butter, prawn, oyster, liver of cattle, egg, especially egg yolk, contain a high amount of cholesterol. Here I also explain the briefly cholesterol, functions of cholesterol, usefulness and its risk. First I also explain its merits and again I also explain its demerits. First, merits. Cholesterol is involved in constructing the cell membrane and its protection. It determines permeability, allowing certain substances to enter the cell. It helps in producing hormones such as androgen and estrogen. Chapter 10, we know the reproductive chapter. Here androgen is the male hormones and the estrogen is the female hormones. Cholesterol plays an important role in producing the hormones of the adrenal glands and in the production of bile. In presence of sunlight, it's also another important topics. In presence of sunlight, the cholesterol in the skin prepares vitamin D. We know how can the vitamin D grow only for sunlight. which is carried away blood to the kidneys to be converted into the active form of vitamin D and again return of blood. Cholesterol is essential for the metabolism of fat-soluble vitamins such as vitamin A, D and K, and for the activities of neurons. Cholesterol is closely related to the prevention of disease. Here I explain the cholesterol's merits, again demerits. However, the presence of high cholesterol is also related to irregularities to the heart and blood transportation. Though it is an important component of bile, it is also a waste product and it is eliminated through the liver. Increased amount of cholesterol deposit in the gallbladder as sediments. The sediment of cholesterol forms stones known as gallbladder stone or gallstone. In addition to cholesterol, phosphate and calcium, the another structure. Phosphate and calcium may also form gallstones. Here, listen, my students. I also give the only short briefly blood vessels, another is blood pressure, third is cholesterol, and our last topic is leukemia. Leukemia. What is the leukemia? Irregularities in blood and bone marrow, and another name is leukemia. Leu means leu come from the Latin words the colorless. Chemia means the cell. So this means the colorless cell. Red blood cells are produced in the liver and the pancreas in the embryonic stage. It starts developing from bone marrow after the birth of a child. These mainly supply oxygen. If the production of RBC, you know what is RBC? RBC or erythrocytic or red blood cell is interrupted for any reason and an abnormal increase of WBC. What is WBC? WBC means white blood cell or leukocyte. The symptoms of leukemia is detected. The cancer of blood cells is another name is leukemia. It occurs because of the abnormal formation and multiplication of white blood cells from bone marrow, which indirectly causes less production of red blood cells and platelets. Though leukemia is called blood cancer, it is in fact a disease related to the malfunctioning of blood production. A bone marrow is the worst affected. Low red blood cell count causes a deficiency of oxygen. As a result, patients become weak, pale, and have shortness of breath. Due to the deficiency of platelets, blood cannot coagulate and bleeding may occur abnormally without any injury from gums, nose, and the other portion of the body. For the same reason, small red spots on the skin and swelling and inflammation of leg joints may be seen. According to the WHO or World Health Organization, there are more than 50 types of leukemia, most of which have high white blood cell count. Though white blood cell increases in number, in fact, these are cancer cells and are unable to prevent diseases as these are supposed. So, a person suffering from leukemia is easily vulnerable to various diseases. Swollen lymph nodes and a persistent fever may also occur due to immunodeficiency disorder. Thus, the symptoms of this disease shows the inability of almost all the blood cells to function properly. However, symptoms may vary based on types of leukemia. Here, my dear students, I also finish this chapter, and next I also give another chapter about briefing. Thank you.